Hello. Welcome to the Shape Your Truth podcast. I am Dr. Kamika Baylor, and on this podcast, we talk about weight loss, we talk about self realization and self development. And today is one of our solo episodes. And on our solo episodes, we are going to be discussing or just addressing hot topics in healthcare. And we're going to call this segment "Okay, BB" because that's what everybody calls me, BB, in my family, and my friends, and my group. So BB's going to address some of these hot topics in her own way, in her own opinion, and we'll see how this goes. How often we'll be able to do this. Okay, so today's hot topics are going to be about detox. Do they really work? And then the second question we're going to talk about are GLP-1 agonists. And why is this so controversial? What's the controversy behind these medications? We'll define that and you'll understand what I'm talking about when I say GLP-1 agonist and what they're being used for. And then I want to address the issue of should severe or morbidly obese individuals, should they be considered disabled? Should severe obesity, morbid advanced obesity be considered a handicap or disability? There's just a few hot topics that we want to address because, like we say here, weight loss is a big area that we focus on in this podcast, in this world of Dr. Kamika, Dr. Bariatric, right? Okay, BB. Okay, so we're going to get to those things, those three topics we want to address today. But first, yes, we're coming to you today just with a deep condition, just wash my hair, deep condition, and kind of like smoothed it down a little bit, and fresh face, just nothing, just did my little eyebrows a little bit, but my skin is very moisturized and clean. And yeah, just wanted to share what water can do for your skin. Just water. Drink water. Clean your skin. Whenever you put on makeup, clean your skin and drink some more water after you do that. And try to get some rest. A lot of times people ask me, how do I keep my skin good? I can't lie, it's genetics. But then secondly, I'll always wash my face every day. And twice a day, in the morning and at night. I never go to bed with any makeup on my skin, and nothing's going to stop me from doing that. Priority every morning and every night. And I moisturize every morning and every night. And now it improved even more, and it looks more pure and natural and just more even toned because I'm drinking water, so I didn't usually drink water that often, as often as I should, but now that I've been incorporating more water into my life, period, and specific type of water, spring water, real spring water with all the minerals and everything, has done a great job at hydrating my skin on my face as well as my body. And I'm usually a very dry person, and I can see it. A great improvement in the how moisturized my skin looks, that natural glow there. I think it's a lot of it is due to good routine, but this texture and no blemishes, and just proud of how it looked. Being 43 years old, I'm proud of the evenness of it, and that's due to water. So that was one thing I wanted to say. Drink your water, ladies. Drink your water, gent. It does so much for your body. It's spring water. It does so much for your body. And a lot of times we are dehydrated on the cellular level. So get you some spring water with the minerals and all of that, so that water can get into your cells and just blossom you in so many ways, not just your skin, but in so many ways in your body. Okay, because your mitochondria is probably dried out. You need a little water. Yeah, so drink water. That's a public service announcement from BB. Okay, so our first topic today is detox. Do detoxes work? Well, there's going to be two schools of thought here. One school of thought is no, they don't work. Okay. And then the second school of thought is, oh, of course they work. I feel great. I swear by them. They've done so much. So oftentimes, where's the truth lie? In my opinion, somewhere in the middle. Okay. That's where the truth lies. So let's talk about, do detoxes work? Detox is short for detoxification. We already know that. So what that is trying to do is help your body. A detox will help your body get rid of impurity, or yeah, just basically impurities or things that shouldn't be there, toxins and things like that. And they're really talked about a lot in the wellness space and in weight loss. So people call them different things: detoxes, cleanse, things like that, where you are set aside. It's not just a fast, but you're doing something specific outside of fasting, in some kind of way to get rid of toxins. Either sometimes you're taking some kind of supplement with it, sometimes you're just eating a certain specific diet with it, and sometimes it's a combination of both. A lot of times these detoxes require you to be near or stay near a restroom, because a lot of it has to do with clearing out toxins via excrement, either urination or defecation. So you're either going to be doing a cleansing or detox based on whatever supplement they give, and a lot of times it's some diuretic or a supplement that causes you to go to the restroom, or laxative. Different kinds of detoxes. There's water flushes, salt water flushes, where you drink salt water really quickly and it causes all that water to rush to your stomach and causes you to have a bowel movement, and people do that, and that's a regimented thing. It's specific to whoever models you're following. It could be a week, it could be 3 days. It's different ones. Okay. And then there's other ones like cabbage soup, or you're gonna make some soup, and you're gonna eat that soup and drink fluids for a certain specific amount of time, 5 to 7 days. And this helps you to go to the bathroom as well and get off some water. All of these things usually causes a weight loss via water weight. You're going to lose water weight, and also you're going to be using the bathroom, so that gets off water. I'm talking about number two. And you're going to get out waste in the form of bowel movement. You're going to get off waste, so that can contribute to your water weight loss, and you kind of feel good because you've had a good bowel movement and you haven't been eating a lot of heavy foods and a lot of inflammatory food you've been abstaining from. So you do feel good. Okay, because all of those inflammatory and processed foods can make you feel sluggish, can make you feel crampy, achy, bloated, and things like that. So that being said, does the detox cause you to lose weight? Well, in the short term, yes, because you're losing water weight. But will that water, your body will adjust, and you will gain your body will adjust, and you'll get back water. Your body's gonna put back on some of that water weight. It won't stay off, completely. But what I do think detoxes do for us is it gets you in the mindset of wanting to do something, right? As long as you go into it knowing that this detox is just a stepping stone. It's not going to be the cure all, and you should not be doing this all the time. As long as you go in with the right mindset, because sometimes we need some kind of change to break those addictive behaviors to sugar and salt and fat and different things like that. And sometimes we use these kind of tools as a way to discipline ourselves to break that habit of constantly eating the processed fatty foods, sugary foods, salty foods, so that we can have a baseline when we start to get on our wellness journey, our weight loss journey, whatever. So I do not say that detoxes are bad for you, or that they work wonders either, or that they're they're going to solve your weight loss problem. No, they won't. They will aid in getting your mindset right together, and that's what it's going to take to do any wellness change or any weight loss change, start any journey that way, or to pursue any type of change, or to start any type of journey. You need to have something go on in your mind to unction you to do the change and continue in that change. Okay, so I feel like detoxes do this for people. It gets their mind in that zone where they want to get on a good path to losing weight, and they're able to set aside those things that are preventing them to do that. So I believe that it's okay to do a detox, like I said, but your mind has to know when you go into the detox that this is not going to be the answer to my weight loss problem, or this is not going to call me to live the wellness lifestyle or holistic lifestyle that I want to live just because I did this detox, okay, or I did this cleanse. But I don't vilify it. No, it's not a magic bullet for editing in any way, but it can do a lot for helping those people who need that kind of detachment from all the other things that they've been doing, and it's been finding it hard to just stop all of a sudden. You kind of like shock your body and your mind and get on track, but you need to know when you're doing that, is that you need to make some real changes afterward, in the way you look at food, the way you look at life, the way you look at what you're taking in. And it's not just about restricting yourself from things, because you can restrict, but you need to have some kind of plan after the restriction ends. Okay, and even if you decide you want to restrict yourself from something indefinitely, like you decide you don't want to eat meat, or you decide gluten isn't for you, and that's something you want to do indefinitely, that's a lifestyle change you want to make, that is perfectly fine. But as long as you know that you need to, for some of these things you want to withhold from, you need to supplement those in some kind of way, because some of these things your body needs to function. You need protein, you need some sugar, you need some salt, you need some fat for to be healthy. You need some. You can't be completely without any of these things, but the quality of those things, what matters the most, and the amount of consumption and the amount of physical activity you're going to do when you eat these things and when you do these things. First thing is your mind and how you relate to these things. They shouldn't be a crutch for you. They shouldn't be a coping mechanism. They shouldn't be your best of friend. Okay, you have to retrain how you think about food and wellness as a whole, and not think of it as some far off, unreachable thing that you can accomplish, because you can. Don't think of it as it is like one day kind of thing. No, it could be today. It doesn't have to be harsh. That's what it doesn't have to be, and it doesn't have to be a punishment. And that's how I think you should look at it. And if a detox helps you to get your mind in the right mindset and break some of those cravings you're having and urges to overeat or binge out on things, and then I think that is perfectly okay, as long as you go in with the right mindset. So that's my idea of detox. Is it bad? No. Is it a cure-all? No. Okay. The truth is always somewhere in the middle. Okay. So, and what if you want to hear if anybody wants to know what the big objection is because there's not much data it's not really been studied. It's not much evidence to say that a detox of any kind is doing any type of long-term benefit. So this is why people say, oh, the detoxes don't work. There's no there's no research that's saying that it does, okay? But we do know how it makes people feel, right? So a lot of what we do as clinicians is backwards a little bit, because we forget to include the person in their health choices and decisions. And if this makes them feel like they're making progress, let them do this, as long as it's not hurting them, and as long as they understand that this is not going to be any kind of magic bullet. Okay, if it makes them feel good, it makes them feel better, then I would not discourage it unless it's something that's going to cause harm to them. Okay, and that's the misconception about detoxes. You see rapid weight loss. So they think that this is, oh, it's working. I lost 10 pounds in this many days. But a lot of times that is water weight. And you've been refraining from things. So you haven't been eating like you usually do. So you're losing weight because, two, you're flushing out a lot of water, and you're going to the bathroom a lot, and you're not eating like you. So if you return to that same way you used to eat, that weight is just going to come back. And the water weight, your body will adjust once you start hydrating yourself again, and that you'll get water right back. So the misconception is that doing the detox is helped me to lose a substantial amount of weight. But when you look at it in long term, if you do nothing after that detox, you're going to gain that weight back. And if you start binging and doing those kind of bad behaviors, you're going to gain that weight back and some. So the misconception is that it's a magic bullet that cures all. Is it safe? Generally, yes. Unless you have some type of bowel obstruction or some kind of GI issue or autoimmune condition that affects your GI, then it's generally safe. It's you generally like having laxatives, it's generally eating foods that cause you to go to the bathroom and things like that. So generally it's safe. When you start any kind of diet, you should talk to your healthcare provider, okay, and let them know what type of diet it is, what you're planning on doing, what supplements you're going to use to do this cleanse, and depending on your medical history, it may or may not be okay for you to do. But generally, detoxes, cleanses are safe. The best thing when you're doing these cleanses are to use them as a way to break a habit. So, like I said, if you want to stop the processed food, you want to stop a lot of sugary treats, you want to just eliminate some stuff from your diet. When you're doing these kind of detoxes, it's a good idea to start that elimination then and stick to it after you finish it. So yeah, so that's what I think about the detoxes. Is there any specific one that I like? No, it's nothing specific. I'm actually someone asked me about one detox, and I'm going to try it to test it out and see. They're very happy and really excited about this detox. It's called the kidney liver spleen. What else was it? It's colon, spleen, liver, kidney detox. And it's a 7-day detox. I'm going to do that with someone I know that wants to do it, and told me about it, and I said, okay, I'll do it with you. There's some capsules that we ordered from this company that's actually in Compton, California, and not too far from where I am. And they sell these capsules called colon, spleen, liver, kidney. And the idea of this detox is that you take 5 of these capsules on the night before you start the detox. And then you're gonna drink 16 to 8 ounces of olive oil, right, depending on how much you weigh. If you weigh 130 pounds or less, you just drink 8 ounces. And you need to do drink this olive oil within 30 minutes to an hour after you've taken those capsules in the morning. So the night before you take 5, in the morning after you take 5 capsules again, you wait a little while, you drink this olive oil, and you chase it with some lemon juice, and you try to get all that olive oil down within an hour. And for the rest of the day, you don't eat, you don't lay down, in the first few hours after you drink the olive oil. And you're supposed to cleanse. You're supposed to basically poop. And then after that, and you stay hydrated. You're going to keep drinking water. They want you to drink lots of water. And then the next day, 2 through 7, you'll get up and you'll have 3 capsules of the CSLK detox capsules, and then you'll eat only fresh vegetables, steamed vegetables, fruits and vegetables, or you can make the cabbage soup that's a different detox thing, but they allow you to do that. So basically you just want you to have fresh fruit and vegetables or steamed vegetables, and you can drink some vegetable broth for the next 7 days, and that'll be your food. Sounds easy when you sounds easy when you compare it to fasting. It sounds very easy, and but will it be some miracle? No, I don't think so. Yeah, you'll probably get a lot of poop out, which if you're having sluggish bowels, maybe that might be good for you. But the best part about it is that you're focusing your mind on making a life change, and that after this cleanse, you're going to keep some permanent changes in your diet, and you're going to increase your activity, and you have a plan after you finish this cleanse. Okay, so this is the one we're going to do. It's called the colon, spleen, liver, kidney detox. It's a 7-day detox. You have the capsules and olive oil, and fairly inexpensive, and you're going to eat fruits and vegetables for the next 7 days. I don't see the big harm in it at all. So there's no real danger at all. Okay, so we're going to try that, and I'll show you guys that stuff too when I go to the shop at the stores and get all the stuff for that. So that's detoxing. Okay, there's nothing wrong with it as long as you go in with the right mindset. Second thing, there's a big controversy out right now about these GLP-1 agonists. You say, what is that? And what's the controversy? Well, you hear all these people talking about getting weight loss medication, weight loss injections, and you see all these signs going up. Do you want weight loss management, weight loss injections? Well, they're talking about GLP-1 agonists. And these medications were developed for people with type 2 diabetes, and it's a way to help with to regulate the glucagon peptide, and so help regulate blood sugars. And it's been out for a while, since like 2005. I remember it being new, these class of medications being fairly new when I was in pharmacy school, and they work pretty good at helping people stabilize their blood sugar. But what they also saw, and what's also a known side effect for these medications, is that they cause anorexia. Okay, and that means that it causes you not to want to eat, not to the state where people were like malnourished or emaciated, but it just meant that they didn't have that as much desire to eat as they did before. And so, lo and behold, all these years later, now they introduce some of the same drug, and now this is marketed toward weight loss. They got FDA approval to use strictly for weight loss. It had been, once they found that this is happening and people are starting to lose weight, those type 2 diabetics are losing weight, they use the medication off label to help with weight loss, and it worked, and it recently got approved on its own under different names, because you have patent under one for one indication, and then you can have a different one for a different indication. And so that's what they're doing. A lot. So everybody knows about Ozempic. Ozempic was originally made for type 2 diabetes, and like I said, after they saw the reduction in weight, they started using it off label to help people lose weight. So then company reintroduces it as Wegovy, same medication at different strength to help people specifically to lose weight. Okay, so that is a class of medication. There's a lot of different kinds with varying degrees of the benefit for weight loss. Now, they all have some weight, can help you to lose weight. They have some of that component, but there are some that help in weight loss at a greater magnitude, and that was the Ozempic, Wegovy, and then there's the Manjaro or the Z-Bound. Those to help you lose weight to a greater extent than Wegovy or Ozempic. So what's the controversy There's tons of other kinds that people are on too, like Trulicity, Victoza, all these different ones. There's a lot of other ones, but these ones seem to work better for weight loss. And the controversy is people, there was a shortage. Drug shortages happen all the time. As a pharmacist, this happens all the time. Drug shortages happens all the time. Just so happened that there was a shortage in the drug of Ozempic, and they had a lot of people up in arms that diabetics weren't getting their medication, attributing the shortage to people who were using it for weight loss. That may not be the reason for the shortage. The manufacturer just didn't make enough. That could be the the clear reason. It's not because they're taking it all from the diabetic people. Because if you really think about it, a lot of these people who are overweight are also diabetic or pre-diabetic, so they qualify to take the medication either way. But it just was a shortage. Like a lot of times there are drug shortage. There's lists every month of drugs that are being shorted. And when you have a brand medication that's made by one manufacturer, there's no generic because they're both relatively new medications. That you see how much easier it is to have a shortage. There's less shortages when medications or lose their patent or go off patent to generic, and you have less drug shortage because you have multiple companies able to make the medication and make it at a cheaper price. So yeah, so there's often drug shortage, especially with brand name medications that have a indication for a global problem. Yeah, there will be shortages from time to time. And in America, obesity and diabetes, they're as big as they come. I worked in 14 years in South LA, and I would say 95% of my patients were either obese and diabetic or obese or diabetic, like everybody. So everybody was on some type of diabetes medication, and everyone was struggling with their weight. The great majority is more people overweight than not overweight. So it's a big problem. That's in LA where everybody's so much more health conscious, you know. But yeah, it was a big problem. And a lot of now I even believe that some of my patients, they weren't taking their Victozas or their Ozempics and all the time, because I didn't see as big of a drastic weight loss until it was on the news that you can lose weight from taking this medication, and then you could see the weight loss. Like some people losing 80 pounds in months, in a few months. But before that, I don't know if everybody was taking their medication. So the big controversy is, should the obese people be given the cheat code to losing weight using these GLP-1 agonists? And yes, they should. They should. I don't think you need to wait to get diabetes. I don't think you should wait. I don't think you want your body to go through that amount of stress from diabetes. Yeah, you can say, well, you made yourself fat and everything like that. Yeah, and that person, you can say that person made themselves have diabetes due to lifestyle. But do I want to wait till somebody that is this big gets diabetes? Because your BMI has to be over 30 to qualify for this, right? And the great majority of my people with type 2 diabetes meet that qualification 2 times over. So looks like they're going to get the drug anyway. But I don't think it's right for them that we withhold medication until they become diabetic. It doesn't make sense to me at all. And why would I have a cure for something for somebody and withhold it from them in good conscience? Yeah, they need to do work. Yeah, that diabetic person needs to do work too. They don't have to let it progress that way. But should I withhold medication because they haven't done the work to help themselves or make some lifestyle modifications? Because both of these are metabolic conditions and have multifaceted problems that don't come from one source. And whether people want to believe it or not, obesity is a disease. It's a condition. It has its own study of medicine. Yeah. So I wouldn't wait. I wouldn't withhold that from my patient. Just like if I have something to prevent my HIV patient or my people that are at risk for HIV, if I prevent them from having a medication, how could I sleep at night? These people deserve that same compassion. So that's the controversy. That's the controversy. And the medications cost a lot because they're brand. And that's what happens. That's what it is in America. The drug companies make a medicine and it's capitalism. They get to charge a price they want to charge for however long they have that patent, and then after that it's free for other people to make it at a cheaper rate. But like this one, they made one for one indication way back then, and now they reintroducing it with a new indication, so they hold their patent a little bit longer. And that's just how we have things set up here in America. And we're blaming people who need the medication just as much as the people who have diabetes, these overweight folks. But the issue is they just need to make some more medicine. That's really it. They want to have complete control of it because that's what capitalism is. They get to do this. Then they need to make some more medicine. Supply and demand. That's it. And we allow them to have this. And if it's really a health concern this way, then maybe we should have regulations to make it where they can't have shortage this often. That's part of the controversy too. And then you can get on the bandwagon of the health plans. If this is really saving people's life, either for diabetes or weight loss, then it needs to be approved. Anyway, if you get these people from becoming diabetic, you'll be saving your insurance company will be saving themselves so much money because it's expensive to be a diabetic. It's expensive to be a cardiac patient. It's expensive to be a renal failure patient. And this is what happens when you have severe obesity. Diabetes leads to cardiovascular disease and kidney disease. And these medications have shown to reduce the risk of both cardiovascular disease and end-stage renal disease. So the sooner they get on it, the better. And I really feel like this is going to be standard of care. So that meaning that if you come in overweight, that's going to be they're going to start you on this type of medication to prevent you from getting all that other stuff and really saving everybody money if you don't get that sick. Same logic goes with the bariatric surgery. If you lose all this weight, you don't have all these health conditions, then insurance doesn't have to pay for this, that, and so many other things. You may seem like, oh, this surgery costs a lot, but what they're saving, allowing you to have surgery, is astronomical. That means less doctor visits. That means less medications. That means less extensive labs. That means less education. You have to go to those classes and all that type of things. Prevent getting renal failure, so no dialysis. You don't have to go to cath lab and all this kind of things because you didn't have a heart attack, and you don't need to be worked up for all of that. So it's saving them money in the long run. I'm not saying there's no issue after you have surgery or you won't have any risk for taking these medications. There's definitely risk, and those risks needs to be discussed with your doctor. If you have any thyroid issues, any pancreas issues, any severe GI issues, you really need to talk to your doctor and sit down and see and weigh the risk versus benefit. It still may be beneficial for you to take this medication depending on your history, and everybody is not the same. But I really hate fear mongers saying, well, you're doing all of this cheating and that's why you're going to get this, that, and the third. I see you get increased risk of that and the third. It's not for you, okay? If you don't want those risks, don't do it. But do not crap on somebody else's savior. Okay, this is what they need. You may not need that, and you know what? Clap for you. Praise God. You found your answer. Let them have theirs. Okay. Don't be so close-minded and don't be so biased. What worked for you may not work for everybody else. What worked for me may not work for everybody else. I understand that. I had surgery and I lost a bunch of weight, and I was able to keep the weight off by fasting. I understand that everybody that's not their cup of tea. Okay. They don't see that They can't wrap their mind around that. They Not that they couldn't do it. They just, it's not for them. So don't crap on what's for somebody else's, what's somebody else's savior. Same thing. People didn't never go on the knife. They did keto. And they've lost all their weight doing keto, but people crap on keto. And just because you didn't do that, that wasn't your vehicle, or you are scared to make any kind of choice, that you crap on everybody else's thing. It's not fair. It's not fair. It's not fair to you, and it's not fair to other people. You wouldn't want somebody to do that to you. And this problem that we have with people being overweight really needs to be addressed. It's really scary how much hatred you see when looking at all these people who discuss their GLP-1 agonist journey and how much they're attacked about using it. It's really, really, really discouraging. It's really scary how angry people are about stuff that it's not even your problem. You're not buying it. You're not injecting it. You're not the one living with over hundreds plus pounds. You're not the one that has to live like that, but you have such a strong opinion that you say mean, hurtful things, scary things to people. We really, really, really got to get back to humanity, because if your issue is so important to you, and if somebody poke that for you and put you down about it, you won't like that. Everybody got their thing. Everybody got something, a touchy subject, something. Some people have more than one. Yes, and that's life. But if somebody kept poking at you about whatever that is, whatever that ouch is for you, you would not like that. So please have some grace on these people. And if you don't like it, don't watch their video. If you don't want to use the GLP-1 agonist, don't do what you want to do, but do something, because doing nothing and talking about it and talking about different people and different things like that is not helping. It's not helping you. It's not helping anyone. So there's the skinny on those GLP-1 agonists. They're not bad. Okay. And they're not just for diabetics. They're not. They're for people who need to lose weight as well. All right. So we get to our third topic of this episode. And it's coming on after this GLP-1 agonist is right in line with that, is next step. So should severely morbidly obese people be considered handicapped or considered disabled? Should it be a disability? Let's look into it. Let's see. What do you think? I'll tell you what BB thinks in a minute. You think about what you think. So severe obesity, severely morbid obesity, also known as class 3 obesity. And that means you have a BMI of 40 or more, 40 or higher. And this level of obesity is significant, and it affects the person physically, and it impacts how well they can move around and all of that. And it also weighs heavily on their mental health as well. So it affects their physical health and mental health. And it increases you for a lot of risks, as we talked about extensively with the GLP-1 agonist. Diabetes, we already know, cardiovascular disease, kidney disease, and all kinds of mental health conditions. Okay, food disorders, addiction, depression, anxiety, all of these different mental health conditions on top of metabolical and physical restraint. So obesity is by definition a illness, a condition. Is not just laziness, or what else do people say? Laziness or lack of discipline. Some of this stuff goes way past that. You're just seeing the result of a whole bunch of underlying conditions, physically and mentally and physiologically, that's going on inside of their system. Okay, so the condition of being severely morbidly obese can cause immobility and affect the joint, leading to a lot of pain. You can have some difficulty breathing, difficulty sleeping because of the difficulty breathing while you sleep, which could also affect your heart and in areas of because of lack of oxygen. And then there's the self-esteem issue. Once people get to a certain point, you'll see what you see on those smooth shows like My 600-Pound Life. They're so self-conscious, or their self-esteem is down so low, or they don't have social connection, that they withdraw from friends, family, society, and they just stay in the house or stay in their room and start staying in the room, and then eventually not leaving. And it's due to a lot of things going on in their mind, in their head, anxieties, and being depressed, and all of this what's called food noise or food talk, where they're like fearing being talked about because they're eating food. They're constantly thinking about what food they want to eat, and they're constantly judging themselves because they're thinking about that food they want to eat. And then when they eat the food, they put themselves down about the food. Then they wonder if somebody's watching them eat and all this kind of thing. So to quiet that noise, they eat again. And then, or they stay in the house, or they do both. And so it's kind of like makes the situation worse. You just cycle of eating and hiding, basically. And then that's how they become recluse and stay in the house. And you get really big. And so then you have not just this mental health, you have a physical limitation where you can't move as you want to. Even if you decide today I'm going to start doing something, it's limited. And then you also have the risk of the, like we said, the joints, the heaviness on the joints. Also their skin, get some skin breakdown, some infections in the skin folds. There's a lot of skin, surplus skin, and those are risk of infection, which could be serious and sometimes serious, very serious in some of the skin folds. And then it leads to like cellulitis and different things like that. So, and bad chafing and fungal infections. So those are some of the serious things that could go along with it. And depending on how early these kind of things happen, it could also affect their education level, because if it starts very young and start being a recluse, not wanting to get out, not going to school, it affects that. Affects the grades they get, because withdrawing from society, or a fear of being teased, or fear of being mistreated by teachers and things like that. The education could be compromised. Even going to the doctor, like those infections, a lot of times they get bad because it's just a hassle to get out the house in the first place physically. And then you get to the doctor and you're going to hear 2 hours about how fat you are, and if you don't do something you're going to die, and all these things like that. And yeah, they know these. A lot of times they know this, they know it, they've probably been on a diet their whole life, they know it. And you telling them again, okay, I know that's your job, you're supposed to. That was my job, I had to do it too. But they know it. And so I think the tone should be talking to them as if they know and that they're involved in the decision making, and let them know that you're making a choice to do this. This is a choice at this point. And sometimes maybe it may need some psychological help or medication to even get in the mindset that they want to do something about it. But I think the biggest thing is it needs some compassion for people. And why I believe this is in fact a disability is because of the mobility problem, the risk of injury to your joints, and the pain associated with being morbidly severely overweight or obese, that you can't get around or you can't do for yourself, is the handicap in and of itself, and a disability. Sometimes it's hard to dress themselves, it's hard to tie the shoes. It gets to that point where you can't like take care of your basic daily needs, and definitely is a handicap and a disability. Even as a child, there needs to be some criteria, even with weight in sports, or weight in physical education. There's no advocacy for this in schools at all. It's just expected that the child should be able to do what the other children they're doing. When you would not have a child who is physically limited in any other way, some kind of deformity or injury or birth defect or something like that, and they cannot do the running, or they cannot do the pull-up, or they cannot do the suicides, or whatever exercises they're doing, and they physically cannot do it, you would not hold them to the same criteria as you would a normally physically functioning student, correct? So why do that to the obese child? Okay, we know they're overweight and it's somebody's fault. Okay, you want to say it's somebody's fault. The child is not really the child's fault though, really. And you being mean to them and trying to force them to do exercises the same way that you would demand of a child that's 100 to 150 pounds smaller than them it's just not fair. And it's you're punishing them for something that is not their fault, and you're causing more harm than good. PE teachers of the world. There needs to be a standard or criteria separate for this, because I do feel it is a disability. It's a physical disability. You cannot test them each week on activity that they cannot do. There needs to be some modification. There needs to be a modification in the actual activity that they're doing, or whatever the exercise that's being presented. And it also needs to be a time difference. If this is how we're grading kids and working out, which I am all for physical activity, but you cannot expect a child that big, or even a person that big, if you were training a person, to be able to do the same thing that you would do to another person. And it's really not fair that this is not being differentiated in school. I had a call today from a parent about this same thing, that she has to go meet with the school and the PE teacher again about the child. And it's the negativity in the PE teacher's voice and how she looks at the child, and the interaction with the child is all with disdain. And this is societal. It's not just that PE teacher. It's how we look at obese people in general. There's no compassion. There's no compassion. It's that pull me up by the bootstrap kind of thing. Okay, but there's no bootstraps. There's no bootstraps to pull up. Okay, they don't have the equipment. They're not equipped with what needs to be done, and what's being presented to them is not a fit for them. So we need to please have some compassion for these people. Yes, it's a disability. Yes, it should be considered one, and policies need to be changed and implemented to stop this discrimination against overweight people. We're making a lot of times, maybe somebody could have been off to a better start away, or they could have been on to making changes more rapidly. But sometimes our tough love, or our pull you up by the bootstraps kind of mentality has pushed their progress back. Instead of, it's not propelling them forward, it's damaging. So yeah, and I feel like there needs to be some sensitivity classes. We have sensitivity classes about all kind of other stuff. There needs to be some obesity bias sensitivity classes, especially in the schools when you're dealing with children, because you are shaping their future. Even if you see it as trying to help, a lot of times this help is damaging, and there's just bias. Even when it comes to healthcare providers, there's bias when they see these people. They haven't walked in their shoes, so they don't know, or they haven't had a person in their family. They just see these as patients that need to get their act together. But sometimes they've been trying to get their act together their whole life, and the act they've been acting is just not working. All the scripts they've been given have not helped at all. So we can't give up on them, and we have to advocate for them, but we have to have some compassion, and we have to be aware and sensitive toward their needs. Or, you're just going to have some more damaged people. Even if they lose weight, they're going to be damaged and constantly needing some therapy behind some of the biases and ill treatment that we've been given. And it's very unfair to hold them to the same criteria as you would somebody who is fully mobile and fully able to take care of themselves independently, and they're not. And yeah, you can say, well, they just set up and ate and got, like, that's one element of it, but it's not the whole story. 99% of the time is way more things than that. And a lot of times it was perpetuated by people doing the same thing to them when they were a child, or some kind of trauma that happened that has not been dealt with. Because why? They've been hiding it really good with food, right? So these people need help. And I would hope that some kind of humanity comes on and turns on inside of your heart, and just have a little bit of compassion for these people, and stop thinking everybody is lazy, because they're not lazy. Some of them just hurting. They're hurting. They haven't been loved properly. They haven't gotten the support they need, and they've been treating themselves, self-medicating the best way they can. They've been surviving. And you saying those mean things, sometimes it's just that one donut and cookie or something is keeping them from doing something detrimental to themselves. So try to have a little more compassion, and think of your own struggle. We all have an inner struggle. We all have something that's a battle of ours, and how you will feel if you want somebody to have a little bit compassion for you. Even if you feel like you are tough and you're able to do it and you're able to pull it off, think about you in your lowest point, and imagine if you weren't strong enough to wake up every day and do something about it. Everybody has not been given the same hand or dealt the same hand and has the same mental capacity. Look at it that way, and then you'll have a little bit more compassion for other people. Okay, so those are the 3 topics that we wanted to talk about. So we ran it up about detoxes. Do they work? Yeah, they work for what they supposed to work for. Get your program jump started, and then do what you got to do afterward to make it happen. It's not a cure-all. It's not a magic bullet. It don't fix the thing, okay? So fix the mindset. Then second, GLP-1 agonist. What's the controversy? Should diabetics and overweight people be able to use this medication? Yes, 100%, 1,000 times yes. Don't ask me no more. And then third, is severely obese people, are they handicapped? Is this a disability? Yes. Yes, it is. It is. And we need to have compassion for these people. Yeah. It is. So those are all my thoughts for today for the Shape Your Truth podcast. So we learned a little bit about weight loss today, and I hope you leave with this today's talk with a little more compassion and understanding for other people in the obese community, and maybe give somebody a hug instead of giving them a bad word or a bad look or evil look or a haughty look. Have a little bit more compassion. Have a little bit more humanity inside you. Okay, so thank you so much for listening. I really appreciate it. Go out there, be great, and stop all this bias in all shapes and forms. Have some compassion, be a little more human, okay, and drink some water, and then drink some more. All right, guys, have a good one.